Hey everyone, I am the nurse doc tutor Asia, and today we will be going over calcium imbalances. And guess what? We're doing it in less than 5 minutes. Let's go. So it is first important to know the role of calcium. So calcium is responsible for strong bones, muscle contraction, and nerve signaling. So let's talk about first hypocalcemia, which is a calcium less than 8.5. So let's talk about some signs and symptoms of hypocalcemia. So I like to think of it like this, that the nerves are too excited. So you will see muscle cramps in this patient. You will see tetany. And one of the big ones that stand out is Shavak's sign. And that's when you tap the patient's cheek, you will see some twitching here. Also Trousseau's sign, and that's when you blow up the blood pressure cuff on the patient, you then will see some hand spasms. Also, if it's really low, you will see seizures in this patient. All right, so let's talk about some causes of hypocalcemia. So the first one we're going to talk about is a vitamin D deficiency. So we know that vitamin D helps reabsorb calcium. We also have hypoparathyroidism, and we also know that the parathyroid hormone is responsible for regulating calcium. And if a patient has renal failure, that then messes up with the regulation of your phosphorus and your calcium. All right. So what are some treatment things that we can do if a patient's calcium is low? Well, it depends on how low it is. We can do oral supplements, or we can do IV supplements. Also, we can have the patient increase calcium in their diet. So we need to know foods that are high in calcium, such as dairy products. Also, we can give the patient vitamin D, because vitamin D helps with the reabsorption of calcium. So let's talk about some signs and symptoms. All right, so let's talk about hypercalcemia, and that is a calcium greater than 10.5. All right, so the little trick to remember hypercalcemia, we're going to think about the nerves, and everything is going to slow down. So patients will experience weakness because of the excessive calcium. That can cause weakness and confusion. These patients will also have kidney stones because of the excess calcium that the kidneys is working overtime trying to filter out and get rid of. And that can lead to dehydration as well as kidney stones. So you want to make sure that you are straining the patient's urine, okay? That is a big NCLEX plug. Make sure that you are straining the patient's urine. Also, the patients will complain of bone pain due to a lot of calcium leaving the bone. So the patient will complain of bone pain, and also this patient will be at risk for fractures, you guys. So one of the biggest things to know is if your patient has hypercalcemia, it is important that you put that patient on fall precautions. Another sign and symptom that's not listed on here, but if the level is really high, that patient can be at risk for cardiac arrhythmias. So you want to make sure that you place the patient on a cardiac monitor. So what are some things that can cause a patient's calcium to be super high? If a patient has hyperparathyroidism, and we remember that the parathyroid is responsible for regulating the calcium. Also, if that patient has cancer, especially bone cancer, which can cause a lot of the calcium to leave the bone, which weakens the bone. Also, if the patient has an excessive calcium / vitamin D intake. So remember, vitamin D helps the absorption of calcium. So what are we going to do? So we want to treat the patient with IV fluids to try to flush out all that calcium. We can administer the patient diuretics as well to try to flush out the calcium as well, because diuretics, that will increase our urine output. Then can administer a medicine drug class called bisphosphonates, and this medication works by slowing down bone breakdown, which would then decrease the amount of calcium that is being released from the bone. All right, you guys, we made it to the end. We went over calcium in less than 5 minutes. I hope that this video helped you understand calcium imbalances just a little bit more. If you have any other questions, leave them down in the comments. Thanks for watching.